My name is Preeti Sheth, and I'm the Deputy Director for Integrated Commissioning in the Portsmouth City, and I work both to the Council and CCG. My role in the IPC is to program manage the overall program, ensuring that it's running on track, making sure that we liaise with NHS England, and addressing any barriers or challenges that come across. The program that we have developed in Portsmouth City is we have started with people with long-term conditions and who are at risk of hospital admissions. So that's what we have started with, and that's where we have working very closely with our voluntary sector partner Age UK through our Living Well program, where we have started guided conversations with people who have long-term conditions. So the next step for us is how do we take those guided conversation into an integrated care and support plan, and then look at what personal budgets can we offer to improve their overall health and well-being. But side by side, we also have done a lot of work on SEND reforms, and we're working with children in continuing care and children below the threshold of continuing care, and see how we can offer flexible services to them. I think what has been going on is that we have got very good foundation of having those conversations with people, because that is the foundation of any program. Because what is it that will make a difference? The IPC does not have to be, it cannot be theoretical, it needs to be very real for people, and that's where the guided conversations will help, which is what is meaningful for them, what is important to them, and then all the rest falls in place. So that I think has gone very well in Portsmouth City. The next step is a technical bit of how we convert those conversations into a plan and into budgets. CCG finance team and CSU have done some very good work in linking the data set and funding. So they have managed to get data of all our people with long-term conditions and what is the funding element and all. And now we are going to link that to our social care data, because we want to try and offer an integrated budget. So then we know about what money we are talking about, what services people are accessing, what is the budget associated with them. And then when we start to have this conversation with people and develop an integrated plan, we can then say, these are the services you are accessing, what would like to change, what can we offer differently, what would people like to offer differently. So we could then put real money and real budgets in place.
My name is Diane Sherlock. I'm the Chief Executive Officer of Age UK Portsmouth. We're a voluntary sector organisation that specialises in supporting and helping older people maintain independence at home, in their lives generally, and to empower their voice to make decisions of their own. Our involvement as an organisation in the IPC programme is around supporting older people to understand the changed process. And our role in this is to support our local Portsmouth CCG and Portsmouth City Council in introducing this changed way of functioning. And from our perspective, it's really important that the individual learns to take some personal responsibility for their own health as part of this process. The differences with this particular programme are wrapped around the fact that we've done a considerable amount of pre-planning in partnership with CCG and Portsmouth City Council, and have developed a Living Well team who are employees of the voluntary sector organisation, and they go into the community now and have a guided conversation which encourages older people to set their own goals about what makes a good day, what improves life. And the idea really at this point is to overcome isolation, to make the older person feel as though they're part of their community again. Now, the difference is coming now with the introduction of the opportunity to take on a personal health budget. And we're doing that by revisiting those clients that have been empowered, feel more confident, and now encouraging them to think about their health differently and how they might like to manage it. I think the key to success is a huge change in understanding from the public perspective as to how they can interact with their own health and take responsibility for it, I know, and I'm fortunate to know, that already our clinical commissioning group and Portsmouth City Council already understand that those changes are needed and they're already taking action, which is marvellous. So with public education on board and becoming part of that partnership working, we'll be able to educate, talk to, explain and encourage that independence in health thinking.